everybody, Max Gattlin here from Handy Consulting. Today we're going to look at the EDATT Dashboard, which is a one-stop shop for all of your access data in primary care. On the left-hand side we see all of the different tabs we have available. So within this short summary we will look at the bot usage data, your online consultation data, reducing telephone demand into your practice, increasing use of the NHS app, what that looks like in terms of quantitative data, so how much time saved, community signposting, workforce wellbeing, resources. So first we're welcomed with an introduction page to the dashboard. We have our filters up the top. If you are a PCN manager or working within an ICB, you can filter here based on the view you'd like to see. So we have a list of PCNs and subsequent practices within those. If you are a PCN manager, you can see your PCNs, for example. If I go to Aylesbury Central PCN, I can now select between my practices at the PCN. If, of course, you are working within a practice, you will be able to only see your practice name at the top right-hand corner. We've got a short summary here, a snapshot of the previous month. So this is updated every month in line with all of the data feeds that we receive from your online consultation providers, your telephony providers, and of course the NHS app team. To start, the first tab is your bot usage data. So we've got an all-time usage number in the top left-hand corner. We do show the most popular time of usage. Of course, this helps us evidence that we're tackling the 8 AM rush within your practice, and that is broken down more accurately as we have a heat map in the bottom right-hand corner showing the usage and the time of day. Dark blue is where there's high usage of the chatbot, and you can see here there is actually also usage before 8 o'clock, showing that people are accessing the dashboard before those telephone lines open at 8 o'clock. This prevents the distressed patient that's called 1 minute earlier, and then they're given the out of hours queue, and then when they call back in 8 o'clock they're suddenly 20th in the queue. What we can see here is patients, even if they're accessing the telephone call queue out of hours, we do intercept them with the EDATT chatbot, and it's showing there that those patients are getting the support they need in an automated manner via the chatbot. We've also got the count of intent per chatbot. So why has the patient come to the chatbot? What are they seeking to achieve? We're also always monitoring the mode of access from the patient's point of view as well. Are they accessing on a mobile or a desktop? And we have the QR code scans up here. As a lot of our EDATT partners will know, we're trying to capture the patient at the point of need. That doesn't just mean sitting in the telephone call queue. It doesn't just mean popping up on the website, but also interacting with your patients when they're coming into your practice. So we do deploy personalised, practice-branded EDATT posters in and around your surgery. One of the most effective positions for these posters is our prescriptions poster, which we send out to your sites, and you can put this, it's A4 laminated sheet above your prescriptions box, letting the patient know that they can now do this online. Scanning the QR code will launch the chatbot on their phone, and the patient is then shown how to order prescriptions online. We've got the chat activity by day on the heat map. You can also toggle to the patient intent by practice to show where the bulk of demand is coming from with regards to the patient intent. Moving on, we have online consultation platforms. It's easier here if I do go into one of our practice sites. And as you can see, again, top left, we've got the total number of online consultations performed all time, and we can filter that here on the date if we're looking to filter that. We've got the most popular hour of day. Again, the most common time of day is between 8 and 9 with most of our sites. That goes for online consultations, telephone calls, and also the chatbot usage. We're also always looking to identify your target areas where you're potentially incentivized financially as a practice to achieve certain numbers or certain metrics that are being measured by NHS England. We will always highlight those to you throughout the dashboard, and of course give them a colour code dependent on your practice performance. Southmead Surgery in January had 300 online consultations per 1,000 patients in that month. The NHS target here is 70, and that does colour code. If you're falling below 70, it will change colour to an orange or a red. Again, you've got the heat map in the bottom right hand corner. We're always trying to map out the patient intent against the outcomes. So the data that we're feeding into this dashboard is what is the patient presenting with, i.e. what does their query pertain to in terms of intent, and where does that patient end up in terms of what is the outcome of that online consultation. We've added multiple filters in the top right hand corner. You can now filter by administrative queries against clinical queries. We've also got patient-led. Of course, depending on your online consultation provider, you may not have a practice-led functionality, but if you do, we can also do practice-led here. So this is the standard view of the online consultation data. We can drill down into an advanced view, which will break that down across the months for you. We can drill into the level of outcomes, map that against intent, and we've also got multiple filters here to filter out any data that you might need. One of our key metrics that we're trying to track is the improvement of access and the use of digital tools to reduce the workload in general practice. And one of the places we've started at is embedding decomposition trees into the dashboard. So if we click on pathways, you can actually now track the level of demand coming through your online consultation provider and what their intent was and what their outcome was. And you can also click around and filter this dependent on what you'd like to see. And we will be building that out to include all modes of access. So on top of the online consultation data, we can connect that to the telephone data and of course the chatbot usage data. The third tab on the left-hand side of the dashboard is telephone demand. If we go into a specific practice, we will be able to see specific phone data for that practice. I'll use Tudor Lodge here as an example. We've got the telephone menu selections, so this is showing the patient intent. We've also got the average queue time in call minutes. So this is where you've deployed EDATT, is the grey area. How has the telephone wait times been affected by EDATT? And you can see here that we've got a drop of average call queue time from 2.5 minutes right down to 1.5 minutes. The fourth tab is NHS app data. Again, we can see the dotted grey line shows when EDATT was deployed. The top left will show you NHS app registrations, and you can see here that after EDATT is deployed, we've almost doubled the monthly amount of sign-ups to the NHS app, which has led to Southmead Surgery getting 69% uptake. Again, this is an NHS target, so we colour code it for you to bring out that small win there. And NHS app uptake is one thing, but I think the key driver here, certainly with EDATT and where we're promoting the use of the NHS app, is the usage data. So it's really important. Bottom right hand corner, you can see here the usage, and a fantastic result and a great example of where the chatbot is promoting use of the NHS app. Again, this could be a combination of QR codes above the prescriptions box, integrating the telephone call queues, and promoting use of the NHS app where possible. But what EDATT does is it will guide the patient through to downloading the NHS app and using the NHS app. For example, where EDATT comes in is offers that patient support in doing so. So you may promote across all of your channels, your website, within practice, your social media, on your telephone, that patients can get their scripts online. But what we found is that patients don't know how to do that. And EDATT is guiding those patients through that process. As you can see, just over half a year ago, there were between 200 to 250 online prescription orders at Southmead Surgery. Fast forward to last month, there's nearly 500 online prescriptions coming through online. I think a key bit of data to glean from this graph in the bottom right-hand corner is that at Southmead Surgery, 6, 7, 8 months ago, there were 200 online prescription orders and potentially 300 manual prescription orders needing to be processed every month. Fast forward to last month, we've now got 500 online prescription orders coming through every single month, and that means that no scripts are needed to be processed manually. Looking at it realistically, there could be potentially 800 prescriptions ordered per month. Therefore, we've taken it from 600 required to be manually down to 300 manual process. If you allocate 3 to 4 minutes per script, you're looking at days being saved in your admin office at your practice. Of course, all of this data is all well and good for us to look into, but what does that actually mean in terms of time saving in our practice? So we've added a new tab here, which is reducing admin time in your practice. And what this does is it allocates between 3 to 5 minutes on average per automated chat via EDATT, and it gives that a time saving for you. So you can see the areas in which you've made those time savings. Southmead Surgery have had over 5,000 automated chat conversations since the 20th of September last year, saving them approximately 53 days in administrative time. The sixth tab we have now available to you is community signposting. As you are aware, EDATT now contains all of your local community signposting services, and we actually automate that signposting by the chatbot so that a patient can access those specialist services faster and also self-refer and don't have to come into general practice to do so. We track all of that data in here, and you can see that at Marcham Road, they've had 8 community signposts in the last 2 months. 5 were last month. They've currently got 6 services which they're signposting to, and the most common of those is the drugs and alcohol service. And as we launch new community pathways through the EDATT chatbot, this will expand. Staff wellbeing, the data is coming soon. Please do get in touch if you would like us to survey your staff. What we will show here is data around the workforce wellbeing improvements that EDATT can bring as a knock-on effect from reducing that workload coming into general practice. The last tab we'll look at is the resources tab. This is your way of communicating with us as your service provider. If you have any issues or a data query, please do come in here and just click on the links. If for whatever reason you've had a change in service, so a community service may have been decommissioned, or you'd like to introduce a new pathway into your chatbot, come here and click on Request New Pathway, and you'll come through to this online form. Fill in your details. Let us know which pathways you're looking to add into your chatbot pathway flow. If it's a community signpost, for example, we've then got examples of all of the services you might want to add in there. If we don't list it, please do just toggle other and let us know which service that is. Let us know the URL for the patient in which they can self-refer. This won't automatically add the pathway to your chatbot. This will notify our team to schedule a call with you to go through a bit of a consultation on the pathway. We can apply our best practice to it, but it's always great to get your local knowledge around that service too. So thanks for sticking with me through this dashboard walkthrough. We hope that you can get as much data as possible to help you improve services and identify all of the improvements you're making towards patient access and freeing up capacity in your practice.